Okay, so thank you everybody for joining our first quarterly stakeholder meeting for all interested parties on everything home modifications. And you'll see here on the screen, we have our coalition name, the Wyoming Home Modification Action Coalition, with all of the partners on the top of the screen who have made this possible. And we thank each and every one of them, but they'll have a chance to talk in just a moment. So just a little bit about WyHMAC. WyHMAC was formed in June last year by the University of Wyoming and the Aging Division, Department of Health. And since then, we have been growing to include key partners such as WyCOA, Habitat for Humanity of Laramie County, and Wyoming Independent Living, to mention just a few. We do have others, but those are our main players at the table. And the aim of WyHMAC is to learn from the best practices of home modifications for older adults and people with disabilities across the state. And from this research, we hope that we can amalgamate or adapt the most effective home modifications approach across Wyoming. And we've made a lot of progress since June, and I'm sure our members will be letting you know in just a moment or so. Some of the things that we've been doing is pulling in funding resources and information about existing funding resources out there. And we've been working on sharing best practice on home modifications and informational resources. We've also spent a lot of time doing advocacy across mainly Albany and Laramie counties and other conferences, and that has been a big success. Raising awareness with our older adult population is crucial for home modifications to work. And we would now like to invite our members, the coalition, to introduce their organizations and involvement with home mods at this point. So yeah, who would like to go first?
Hi, everyone. This is Dan Dorsch, Habitat for Humanity of Laramie County here in Cheyenne.
Thank you very much. And is there anything, Dan, that you feel inspired about home mods or what we've done over the past 6 months and some of the work you've done maybe?
Yeah, excuse me. Yeah, I just think the coalition is really good because it's bringing awareness to a really important issue for several reasons. Obviously, it's keeping people that age in place safely is really important nowadays. And then also the, I don't know, the, yeah, sorry, I lost my train of thought.
Oh, no.
Yeah, I don't know. I can't think this morning for some reason. So I'll just say that it's good to bring people together to work for the home modifications to keep people to age in place. And hopefully we can get more people to age in place safely and keep them safe. Yeah.
Thank you very much, Dan. Yeah. Bernard, would you like to say a few words?
Good morning, everybody. My name is Bernard Steinman, and I'm one of the co-chairs of the WyHMAC project. I'm faculty at the university and have a background in aging in place and home modification. So we are, I think, doing a good job of trying to develop access to home mods in Wyoming. I am not with the Wyoming Center on Aging, but I collaborate with them frequently on research and other areas. So they also are involved. I'm not sure if Catherine wants to say anything or not, but WyCOA is the part of this that's going to be focusing on the research elements. So.
Sure. Hi, everyone. This is Catherine Carrico, Associate Director at the Center on Aging. Good to see you all. Yeah, we're here to help support research, anything we can do to support grant efforts and grow the movement across the state.
Okay, and if any other members want to say anything, feel free to jump in, but
I don't think we have anyone from Wyoming Independent Living this morning, but they also are one of our coalition members.
Yes, indeed, and they've been a great help with finding resources and the home modifications across the state, and how it sits and so on. So they've been a great addition to our coalition. So we'll certainly move forward now with our next slide, which is just letting you know what the agenda is for today. So we'll be going over our WyHMAC's mission, our goal and objectives, what basically home mods are, and an explanation of the different types. We'll be going into those funding sources that we mentioned. We'll be going into information on handy workers and the list that we're trying to create of licensed and insured handy workers across the state. We'll be going through lists of our stakeholders and other key partners and asking for our involvement from all of you here today. If there's anything you would like to add to our coalition or any information, that would be great. Going through our website, and our grant applications will probably be the most crucial parts there. Just move us forward. Okay, so our mission statement for WyHMAC is to promote home safety, independence, and quality of life of Wyoming residents through increased access to home modifications. And so that is the whole point of why we're here. And all of these quarterly meetings that obviously we got set up throughout the year will be to give information updates and what's going on to help us to achieve that mission statement. So that is our focus we come up with about 2 or 3 months ago now. So a list of some of our objectives. There has been some statewide research done for this, the Wyoming State Plan on Aging. It was published in about August, September this year. And it did indicate a need for better home modifications in Wyoming. Also, other studies where Bernard has carried out for age-friendly Laramie indicated that this is an important area that we do need to address. And so we came up with these objectives, and obviously one of the clearest objective is we need more successful home modifications in Wyoming. There is definite need out there that we are not meeting yet, and so that is our overarching objective. But inside of our objectives, there are 5 arms, so to speak, of what we want to get there, how we are going to get there. And one of those is creating this unified or standardized network of many different organizations. So bringing everybody to the table, finding the best practice, and eventually developing content, but at least collaborating with existing content out there. That is a crucial part. We also would like to complete some research through Bernard and the University of Wyoming and other partners to see what is working, what is not, and where we can go in the future. So some targeted research is important. And we do want to create, which we have done, we're going to announce that later, this website of information, a central hub where people can go to with links and resources for home modifications, holding regular trainings, which this is one of those, but for anybody who's interested in finding out more about home modifications and how it is different from a simple refurbishment or an upgrade to your home. It's more medically based and to improve quality of life. And lastly, of course, raising awareness with older adults that it isn't going to create your home into a hospital, but you do need your home to be safe and accessible. So those key points that we are trying to raise awareness through our senior centers across the state and other places. So yeah, anybody else want to add anything for these 5 comments, 5 objectives? No, we'll move on. Okay, so here it is again. It's just maybe a slide should have gone, but it's simply the same thing. It says advocacies or the targeted research and the resources for OTs and handy workers that we want to at least consolidate, if not create, eventually. And this is our overarching goal. And so now we're going to go into a presentation about home modifications, explaining what they are and the different types. There are multiple different types of home modifications. And so for this part, Bernard, if you would like to take the stage, and you can just tell me to move on slide so we can move the slides along.
Okay, well, thanks, Mark, and thank you everybody for participating today. I see we have 17 participants, which is awesome. Not sure how many we expected, but I'm glad to see that our network is expanding. So Mark didn't mention, but the way that our coalition is organized is that we have multiple tiers of stakeholders, and a small group of us, 5 or 6 of us, have met on a weekly basis since June to talk about home modifications and maybe establishing some way to get better access here in Wyoming. This is, I believe, our tier 3 group, which we're hoping that we can keep you all involved with quarterly meetings. And we hope to grow this group because, as you saw in the previous slides, one of our main goals is to improve awareness of home modifications. I think probably most of you, based on who you are aware, but we want to keep spreading the word and get it out to older residents and residents who have disabilities. So Mark, can you change the slide, please? Some of you may have seen our presentation. So one of the early steps that we're taking is to try to get out into communities and talk about home modifications. We've been to the Epson Center. We've been to some community meetings in Cheyenne, and we're hoping to do more of that with the new year. So we show this slide really just to make the point that there's, and everyone knows this, I think, that there's great diversity in the older adult population. We have people who are extremely frail, and we have people who are extremely active and really kind of doing things that are maybe surprising and different than the way that older people have been perceived to be in the past. And so this diversity provides a challenge in terms of coming up with alternatives for people as they get older and their needs change. Next slide, Mark. This is indicating some research that I think everybody in the room is aware of, and that is that people want to age in place. Nursing homes tend to be getting more and more, the intensity of care that they're providing or the needs that people have in nursing homes are becoming greater. So we're trying to make nursing homes the resort or the alternative of last resort. And so what we really like to do is keep people in their homes. And if it's not possible to do that, then to try to keep them in their communities for as long as possible, as is their preference. Next slide. So this is a picture that we showed to try to illustrate probably what is common in the housing stock. We refer to this as Peter Pan housing. This is housing for people who never want to grow old or never think they will grow old. This was probably built in the middle of the last century when times were a lot different. We didn't expect, or people weren't buying homes to age in, they were buying homes to raise families in. So the design of this home has some things that I think probably most people could pick out. Steps, if you had a hard time with steps, you'd have a hard time getting into your house and using the upper floors of the home and so on. So this is not uncommon. Unfortunately, much of our housing stock is looking like this. And rather than tear them down and start over, what we propose is modifying people's homes so that these homes can be used by people who have different abilities. Next slide. So supportive home environments are important for obvious reasons, I think. Homes are where people spend most of their time. People want to have control over their own lives. They want to be able to make their own decisions. People who require caregiving, home modifications also help people to provide care to their loved ones. Home modifications are instrumental, I think, for falls prevention programs. And so we want to have that as one of the elements in any fall prevention approach. And so overall, supportive home environments are key to aging in place. And so we see this as an opportunity, I think, to raise awareness and to really make it a area that people know that by modifying their homes, they can help to, or that can help them to reach their goals to age in place. Next slide. Fortunately, researchers have identified some common problem areas. These pictures, usually we have a discussion here, but I don't think we have time to do that. Outside steps. So here you can see a gentleman trying to maneuver down these steps without really any handrails or any indication even that the steps are there. If you had a problem with vision, then that might be difficult. Inside stairs also, and also bathrooms. So the pictures here we use to demonstrate some of the difficulties that older adults have in these sort of key areas. Next slide. I think you can think about home modifications in lots of different ways, but we've sort of taken this approach to think about them in terms of whether they're additive. So whether we're bringing something into the home, whether it's assistive devices or grab bars or just improving the lighting, whether it's subtractive. So lots of people have hazards in their homes and going in and identifying those and removing those. Adjusting people's behavior. So people often have old habits that may be hard to break, and making people aware of how those types of things can place them at risk for falls and injury is also a way to think about home mods. Rearrangement, so just making a clear pathway. We want to be cautious because sometimes people have organized their homes in ways that make sense to them and may not make sense to those of us who are assessing their homes. And so we want to be receiving input also from the resident. And then transformative are these major renovations. So people often think of home mods as being big things that cost a lot of money, like widening doorways or adding ramps. We like to point out that that's not always the case. In fact, most home modifications are smaller and not as expensive. So next slide. So just to give you some examples of additive, these, I think we need to update our pictures because these are not probably the best types of grab bars, but we want to start thinking about getting people's bathrooms safe by adding grab bars and adding features that are safer. Next. Lighting. So Mark, you can just shoot through these slides. Lighting is a really simple fix and can improve people's functioning. See a happier man when he can actually see what he's trying to read. Next slide. Subtractive. So unfortunately, this is not my house, but it could be my house. People tend to gather things over time, and this sort of clutter makes it unsafe. So one of the things that we can do is get in there and try to encourage people to get rid of things they don't need and to try to remove some of that hazard. Next slide. Rugs and carpets. So again, a simple fix, just coming in and either removing the carpets that can kick up and create trip hazards or just affixing them to the ground. Next slide. Behavioral. So we show this slide, and oftentimes you can almost hear a little gasp as people see this woman up showing us how she performs certain tasks. The things that people do, sometimes if you make them aware, or if you make their families aware, it can help them to better understand and to make changes that can reduce risk. Next. Yeah, so as an alternative to storing pots and pans above the refrigerator, as the previous woman did, arranging them, hanging them in ways. This wouldn't cost anything really, I think. So again, just to make the point that home mods are not always these expensive things. It's just recommendations that can make functioning in the home easier. Next. Pull-out drawer, same idea. I think this makes the point that design is really important in home modification, making things attractive, making it so that people want to exist in their environments and not making things worse. Next. So transformational. So this is a great example of a home modification that a friend of mine made for his father-in-law who needed to move in with him. This walk-in shower has lots of features. This is transformational, so probably was somewhat expensive to do, but it has great features, including things like contrast with the grab bars and the tile, non-stick tile or non-slip tile, anti-scalding devices, and great lighting in there. So this is a really good example of making a bathroom functional for an older adult. Next. So one of the approaches that we're trying, as I think Mark mentioned, we're trying to take an evidence-based focus. So we want to do things that are shown in the literature to work. And one of the things that we know is that home assessment, having a professional go into the home and identify things that are known to be risk factors is a good way to start. There are lots of checklists that older adults themselves can use, and we will have these on our website once we get that up and functioning. So some of you have probably seen these checklists where they basically just tell you areas that we know are places where risks occur and ways to address those risk factors. Next. So we know, fortunately, that home modifications are effective. There's lots of research that's been done that shows that when you modify people's homes, it reduces falls risk, increases quality of life, increases physical functioning through activities of daily living and instrumental activities of daily living. So one of the things that we want to do as a coalition is take a really long, hard look at the research that's been done, and if there's a way that we can to add to the research, since we do live in a unique environment, we want to be able to do that as well as part of the coalition. So these are some program and policy challenges that we've identified or that we know about and that we're trying to address through our coalition. So lack of awareness, that tends to be pretty low-hanging fruit. All we need to do is get out there in the community and make people aware of the benefits of home modifications. There is a shortage of trained workforce professionals to conduct assessments, especially in a place like Wyoming, where things are spread out. It's difficult to get the people that we need to the places that we need them. So this is a challenge that we're looking at addressing. Home modifications and home environments are often overlooked in retirement planning. It's not well coordinated with healthcare, which is a problem we're trying to address. Sometimes it's difficult to access products, although that is slowly changing. And funding is difficult. It's inadequate and it's sort of fragmented, which is a thing that we're also becoming more aware of, but hoping to address. So this slide just demonstrates the number of potential, the types of people that might be involved in providing a home modification. You can see that it's a wide array of different types of people. And this creates a challenge. Trying to organize any project can be challenging given the numbers of people that need to be involved. So this is an area that I think we're going to talk about a little in a bit of how we're trying to address the patchwork delivery system. So these are some of our next steps to recognize the role of housing in fall prevention. I think that's becoming more evident. People are more and more aware of that, but we really want to drive that home. We think that home modifications can be cost saving in the long term. And so we want to make that evident to people who can affect change. We want to raise awareness, as we've said. We want more widespread implementation of evidence-based home modification programs, which we have some ideas about that, which Kristen, I believe, is going to tell us about. Increase home modification training of professionals. Once again, we want people to know that it's not just a matter of going in and screwing grab bars in. We want people to know that that there's a right way to do it that actually improves safety. And so we want to make that one of our focuses as well. We think we need to encourage innovative funding mechanisms. One of the biggest challenges is figuring out how to pay for these types of things. Most cases, in each case, it's different. And so that is a area that we want to focus on, is how to fund projects. And then also there's the potential to change codes to require universal design features in new housing. So thinking not only about the stock that we already have and modifying that, but also how to think about making sure that new housing meets the needs of older adults. Next. I guess that was my last slide. So thanks.
Thank you, Bernard. So we're going to take some time now. If you do have any questions on home modifications and anything that Bernard went through, our next steps, the different types, things like the behavioral, possibly, please do speak now. If not, we'll move on to current funding sources. And don't forget, you can use the chat feature as well at any point, but we'll move forward for now. So in these slides, we're going to go through about 12 to 15 different types of organizations that we know of that will help with home modifications currently in Wyoming. And one of our good friends at the University of Wyoming created this, so this is a very helpful resource. The first one is actually one that I do manage, but we do have the Emergency Rental Assistance Program, Housing Stability Services through the Aging Division for older adults and people with disabilities, with a $5,000 limit on home modifications for IRAP clients who go through DFS. We are still in the early stages of actually finishing projects, but projects are starting across the state. But as you probably can tell from Bernard's presentation, getting the right professionals to do the construction, and then obviously making sure that the evaluations are done before and after, it takes some time. So we hope by next quarter, we will have some successful home mods through this program, which would be fantastic to relay how successful they were. That's my hope anyway. We do have other home modification programs through the HUD, through the HUD, enables low-income elderly persons to remain in their homes by affording these home modifications, to enabling people to age in place. Again, it's that term that we use a lot, but you're going to be hearing a lot more with home modifications. The whole point of this is to enable people to stay in the community for longer, and ultimately it will save the state money, because it's more affordable to care for someone in their own home, which is what they want anyway. So it's a win-win. So the HUD do offer for 62 plus these home modifications. And we do have here the Wyoming Services for Independent Living, or WHISTLE, who take on these home mods, ramps, bathroom modifications, and so on. Funding provided by Community Choice Waiver. So again, there's that Medicaid connection there, which is great, and serves the western portion of Wyoming. And so they are a very big player in the home modification arena. Then we have the Section 504 Home Repair Program, again, for those low-income homeowners, to enable them to modernize or update their homes. They must live in that rural area, less than 20,000 people, which most of our towns in the state are like that. And there has to be in that poverty level, federal poverty level. And again, it's that 62 plus age when that will come eligible. And we also have the Technology Access Program, or is the Assistive Technology Resources, who do provide access to technology that will help, again, that independence, things like the PERS program, the Personal Emergency Response System. Again, it means that if you're in danger of having a fall, that you can call for help and help will come. Again, it helps keep people feeling safe in their home and so on. So there are those grants for that technology available. Again, it's not just ramps and bathroom remodels, there's all different types of home modifications to help people age in place. And we have our one of our key partners of WyHMAC. We have Independent Living, Wyoming Independent Living, who again, they do the same for the eastern portion of the state that WHISTLE does in the west. So there's ramps, bathroom remodels, and so on through Community Choice Waiver to fund them, which is fantastic. Volunteers of America, elderly home repair or basic needs, low-income elderly funds needed to repair homes based on income guidelines, and the application must be submitted by the personal agency to them, and they will provide some funding. So, you know, of anybody who needs assistance that they can't get through the Asian Division, for example, or somewhere else, all of these organizations are good places to go. And we also have our Wyoming Home Services Program for those eligible participants, with home modifications up to $300 per applicant per year. Other services are care coordination, personal care, and adult daycare that are included in WYCE. Client must be 18 years of age or older, and at risk of premature institutionalization. So WYCE is a good home modification advocate. We also have LEAP and WAP for those installation of those homes. Again, if the home is warmer and safer, it means that older adults are able to stay in there for longer, which is great. So this will all help with that home modifications and aging in place agenda that we have. We also have Wyoming Cares. It's a statewide not-for-profit charity set up in 2001 for those who are seeking temporary assistance in times of need. And so applications go direct to them, and they will assist with funding for home modification. So again, a lot of these funding sources are good if you need to have a large scale project that one organization cannot fund on its own, to do a patchwork of funding sources. And this is where having somebody to advocate for the older adult is crucial to enable these different funding streams to come together to finish a project. And so we definitely want to have more representatives from all of these different groups to come to the table to help manage these larger scale projects, so we can get more home mods done in Wyoming. And lastly, we have the Travis Roy Foundation, lastly but not leastly, quality of life grants, funds, and adaptive equipment and technology for paraplegics and quadriplegics. So again, it's assisting more with disabled adults rather than older adults, but still a very important player in the home mods arena. So that was our portion on funding sources. Is there any questions on those, or anything that anybody would like to ask or add to that piece of the presentation? And we do welcome your comments and questions.
I think those slides make a really good point about all these funding sources have different people that they target. And I think that that's, as I said, a major challenge in what we're trying to do here is figure out when somebody comes through the door to ask, you know, what can I do to modify my home? Finding out where is the appropriate place to direct them for funding if they're not going to pay out of pocket is one of the big challenges. So I think we need to really kind of think about that moving forward.
Indeed, thank you, Bernard. And this section, we're going to talk about our handy workers database and our collection of all the different lists across different city councils and county authorities and governments, trying to compile a list of good handy workers that are licensed and insured, so we can provide those lists to people so that you're not searching and hunting around for good quality construction worker who will be able to do this and keep everybody safe and get the job done well. So if Kristen is on the line, are you there, Kristen?
Hey, yes.
Oh,
I was just responding to Tammy's chat. So we'll put all the information in an email, and then as well it will be on the website once we get that more solidified and up and running, or once we build it a little further.
Thank you, Kristen. And Kristen Glennie is our AmeriCorps Vista member who's been with the Asian Division now for 6 months, and she's been such a fantastic help with our work at the Asian Division. And one of those many things that she's been doing has been working with Dan from Habitat for Humanity on these lists. So over to you, Kristen.
Right. So as we've been talking about, the patchwork of professionals is the largest problem regarding home modifications. And so we've been working to build a repository of handy workers that are qualified and certified by the state. So if you move to the next slide, I think we have a little bit of information about that. Right. So it's really important that the handy workers that we contract with are licensed and insured and bonded. That's just, you know, a safety mechanism. We want to make sure that if we're employing someone to go into somebody else's home, they're going to do a good job and they're going to be just square with how they're doing things. So that's kind of one of the things that we've been struggling with, or not struggling with, but really trying to parse through and collect that information soundly for everyone. Just there's massive lists from around the state, and we want to make sure that it's easy to access. Move to the next slide, please. So WyHMAC member Dan Dorsch from Habitat for Humanity, who spoke about this earlier, has been working to compile a spreadsheet with licensed and insured handy workers, and it's just making it that much easier for people to access the appropriate information and get the home modifications that they need. So it's kind of trying to find people that are licensed and insured, and also meet people at what their jobs actually are. You know, just because you're licensed and insured doesn't mean that you're a pro at redoing someone's staircase or installing grab bars or widening a doorway, etc. So we're just trying to make it that much easier is the point. So I don't know if, Dan, you have any updates on that or anything you'd like to share about that, but.
Yeah, thanks. I'll just say it's kind of been slow going.
Yeah.
Especially here in Cheyenne and I believe across the state, you know, there's contractors is just really, really busy right now. And it's been hard to get some of them to call me back and let me know, but there have been several. You know, I spoke to a guy in Cody and he said he does. And then I'm in working with the ERAP HSS program as well. I'm finding more licensed people who work on home modifications as well. I just discovered another plumber who does bathroom modifications, and so we'll be adding them to the list as well.
That's great. Slowly but surely.
Yeah. The most of the bigger cities around Wyoming have lists of licensed contractors, but as you mentioned, Kristen, they're pretty expansive. So it's instead of just throwing those lists up there for people to parse through themselves, we feel it's beneficial to try to find a small group of each different type of contractors for people to reach out to. So hopefully we'll make some more progress on that in the new year.
So I guess, sorry.
Yeah, I just wanted to add that it's probably a task that will never end, and it will be something we'll have to update every 6 months, a year, whatever time period. So the work that everybody's doing, Dan and Kristen, is so valuable, and it will be probably an ongoing thing. Whoever's in the future will do is just to make sure that we have those good lists of current contractors and so on that we can build from, and actually getting information from everybody here who's going to be working more in your communities and feeding that to us of recommendations is a good help as well as we continue updating of this information. So just wanted to mention that as well. Thank you.
Yeah. So current contractors, but also contractors who are willing and able to do these smaller projects. So that's the big challenge. We, as Dan just said, we don't want to just throw up a list of people who have a license in this county. We want to know that people have experience installing home modifications and that they're willing. So this is, I think, one of the things that I find interesting about trying to do this in Wyoming is that our landscape is so different. We have long distances between people, and who wants to go out for, who wants to drive 2 hours for a $150 job. So I think this is going to be one of the areas we need to find creative solutions to resolve.
So at this point, we'll be trying to connect with our statewide stakeholders, which many of you are in that category of interested parties who are interested in home mods. And this is our chance to sort of catch up and find out how it is for everybody else who doesn't join these weekly and the monthly meetings that we have in WyHMAC. So let's move on to our next slide.
There's a good question in the chat about supplying us with contractors that they know do home mods. So maybe we want to jump back and think about how we're going to take stakeholder information as we build our network.
Okay.
I mean, regarding that question with giving us names, please feel free to email myself or Mark or Bernard or Dan, or just any names or leads that you may have. That would be really helpful. If it's someone you know that you've worked with in the past, and there's good carpenters or handy workers, that'd be really helpful.
Absolutely, absolutely. Thank you, Kristen. And that's part of this section here is that we can't do, this coalition won't work without the wider Wyoming organizations and the public as well, who need to be aware of this. So it is a group effort, which we are happy to spearhead and to move forward, but we need everybody who is interested to try and contribute in some way in terms of mentioning it to older adults who may be dubious about home mods, or sending us information on contractors. It's great, but also we are lacking some medical professionals, nurses, OTs, doctors, and so on, who have the time and have the ability to move with our coalition and to provide that medical component that we are lacking. We have state professionals, we have university professors, we have Habitat for Humanity and our contracting groups, but we don't have those medical people that we can lean on for that portion as we develop. So anybody who's out there currently who's interested, contact us, or if you know of somebody, send them to our way and we can talk to them and see if we can, even if it's just once a month or on these quarterly meetings, anything does help. So we wanted to put that out there at this point. Any more questions? No worries, if not, we appreciate questions that have been coming. So let's move to the next slide. And Bernard, I think this is a part for yourself.
Okay, so let's see. Can you go to the next slide just to remind me of what I'm supposed to say? I think I'm just supposed to announce that we have a website that you can go to.
That's right. Yeah.
Yeah, and so some of the questions that have been asked about where you can find this information, it may not be there now, but it will be shortly. So here we've got some. This is on the UW server, and we will have all of the information that you will need to contact us and to just participate. I think information regarding meetings and so on. This is really in its formative stage. I think in a few weeks it will be much better, but we plan to provide information to the state about, or to the communities in the state about what home modifications are, their efficacy, and so on. We want to provide resources for consumers, including checklists and information about how they can get the process started, and then also resources for professionals who want to become involved. So I think our vision is to form these networks of OTs, medical professionals, and handymen who want to specialize in home modifications, and to have them listed on our website as possible resources. So in the future, you can check back to the website for information about the progress that we're making.
Absolutely. So just want to go through some of these things, even there's not much there, just so you can all see. Do save this website somewhere so you can check back during the next few months and into this year. uwyo.edu/homemods is the one to save. Some bits are again under construction, so but we are making progress. We have a site, we have a Wyoming specific page, and that's all that matters right now.
We're
And
doing
again,
this on the Wyoming UYO server, and they have lots of little rules which we have to get by one. And so, yeah, that's why I didn't click on any of those links, because they're not ready yet, but they will be.
let's see if I can. There we go. Okay, so thank you very much, Bernard. Appreciate that. So just another mention again about the IRAP. Obviously, I'm not going to go too much onto that. We've already mentioned that before, but I do want to mention that we are making progress with home mods across the state, but projects are slow and they take time, and take time to do right as well. If you know anybody who's interested in and you think may qualify for, again, the rental assistance program is the main. It's the primary one they must apply for and get accepted by, and if they are accepted by that, then the HSS program is a secondary component which they can apply for and get that trade or mobile home repair or that home modification that they need. And we've seen a lot of need across the state, and this is not localized into this is across the state. We are seeing, from my perspective, from this one program, there was great need out there. So everything we're doing, especially with the other 15 different funding sources out there that we know of, it is much needed. Okay, so if there's no questions on what we've previously discussed, Kristen, I believe this is a portion for yourself on the Capable program you've been working on the past 6-7 months. So,
yeah, so Capable is an evidence-based falls prevention program that we've identified and think would be a really effective tool in Wyoming. Essentially, it's what we've been talking about, patching together this group of professionals that are really hard to come by on your own. And it just is a delivered plan for older adults who struggle with falls or hospital readmittance or are at risk of falling. So it involves an occupational therapist, a registered nurse, and a handy worker. So these 3 professionals, as this whole meeting has been about it, they're really effective in helping with falls prevention and just long-term aging in place. So by involving an occupational therapist, it allows for home modification assessment, as well as help with improving ADL and IADL functioning. So the IADL component is one realm that they really emphasize in the program, because that's kind of taking into account what people want to be able to do in their homes. And that just starts to build this trajectory of, I can accomplish this in my home. What else can I do? What else can I get better at? And so that really helps with mental health, which is another component that the registered nurse actually helps with. So as we've seen over the course of the pandemic, social isolation is a massive problem that's really been highlighted. And so the registered nurse comes in and can help mitigate some different social isolation realms, as well as, medicine management. And then the handy worker goes in with the suggestions from the occupational therapist to install the home modifications that would help that individual age in place and just stay in their homes for longer. So this program, I believe it's more detailed on the next slide, but it's a 4-month intervention program. And so during this time, all 3 professionals go into the older adult's home, and they really work together, which is a key feature, I think, that really helps it be so successful, because they're all working together and sharing notes and reading the notes from the other person that they're giving to the older adult. And so it's just this huge, cohesive package. And I think that's what makes it really helpful. So over the course of this duration, the 4 months, they are given a $1,300 budget, which is variable from state to state, but that's what the trial was with. And they're just able to really accomplish and show that this is effective long-term, and it keeps people out of nursing homes. So the total cost of the program is approximately between $3,000 and $4,000. Of course, that varies state to state and city to city, town to town, but that's something that we'd be really interested in, because long-term it would be saving the state money and saving hospitals money, which is really effective. It's also allowing people to live in their homes, which is what they really want to do. So if you go to the next slide, please. So this is just a bit of a breakdown of some of the numbers. So as you can see with these pie charts, there was a massive improvement in ADL and IADL limitations. The one on the left is ADL, the one on the right is IADL. So 74.8% of people improved ADL functioning and 68% of people improved IADL functioning over the course of the 4-month period. And then long-term, it's also been shown to maintain those improvements. This also, if you look at the graph at the base, the cost of capable compared to what Medicaid would be, or Medicare would be rather, over long-term spending is significantly less, which is really helpful in just being able to redistribute that money that is saved to other health promoting programs to make everyone healthier. So if we go to the next slide. I find this program really exciting, and I think it would be really effective in Wyoming because it's really person focused. You know, it's these 3 professionals like actually going into someone's home and giving them a program that's personalized to them. And so it really fits you well. You know, it's not some cookie cutter thing. It's really trying to help said individual improve their lives. And I think that's really meaningful. It also provides the resources. It's 3 professionals that are there for you, that like are focused on what you need. And it's not just like trying to contact this person and this person and this person. So it just makes it easier for people, which is huge. And then again, as I mentioned before, building that self-efficacy from achieving goals through ADL and IADL functioning. And that can be really motivating for people, especially as you age. So next slide, please. So really the question that we're trying to answer is, can we adapt this program or adapt this program in Wyoming? A lot of these test sites, all of them are marked in either the yellow or the orange. And a lot of those places are not very similar to Wyoming at all. So we're really trying to see what we can do here to make it most effective for the populations that we have, and like given the vast rural environment and some limitations with workers, how can we best implement this here? And so we've actually applied for some grant funding to try and like answer these questions. A lot of the grants are just getting a startup site, but also doing some research to see how we can implement it better. Next slide, please. So yeah, these are the 2 grants that so we've applied for one through ARPA funding, and we're applying for another one through ACL for a falls prevention program. So Capable is by nature a falls prevention program, though it's also like home and community-based services with the other 2 professionals. So we're still waiting to hear back, but we have some high hopes. I think our grant proposals went well and are going well. And so we're just still trying to work on building the group of professionals that we do have to make this the most effective as it can be. So like Mark had mentioned earlier, we're working on contacting other health professionals. That's an element that we're missing right now, as well as finding the best test sites. So there's a few age-friendly leaders on this meeting today. And I think that could be a good place to start the program, but we're also trying to spread out. So any ideas are really welcomed. We're still in the application process for the ACL grant. And so we'd love to hear feedback from people.
Yeah, that grant is due at the end of the month or toward the end of the month. And actually, I sent out some invitations to this meeting over the weekend to try to get some of the people that we think can partner with us on the ACL fall prevention grant. So this may not be the place to talk about it, but we're hoping to rope in some of you as partners and who will possibly provide letters of support and ideas about how we could implement falls prevention programs in Wyoming.
Is there any questions on the proposals or anything related to funding applications that anybody has?
I will just mention that the ACL grant, so the ARPA grant is already in and it's being evaluated. Not sure what the odds are of us getting that, but basically we propose to go out and implement the Capable program in places across the state. So that is in progress. And the thing that we're working on now is the ACL grant. And what that entails is proposing 2 falls prevention programs that can be implemented online, essentially. So we're proposing Capable and a falls prevention program called Falls Talk, I believe. And so we want to try to entice the age-friendly communities that are in Wyoming, Casper, Jackson, and Laramie, to participate in that grant writing process. So you may be getting some invitations in the coming days to talk with us in more specifics about that.
Wonderful. Thank you, Bernard. And don't see any questions yet, but I'll give you 15 seconds to say something on the mic, and feel free to do so if you have any questions. Okay, not hearing any from the floor. So we're moving on now to our research components, our research branch, which Bernard, if you don't mind taking the lead on this one.
Sure, I thought we just did that. Can you change the slide? Okay, yeah, so we are, I just told you about the grants that we've submitted. The ARPA grant, which is the American Rescue
Plan Act, I think.
Rescue Plan Act.
Yeah.
We propose to basically buy the license for Capable and to implement that in 225 homes across Wyoming. So as Kristen just mentioned, we want to assess whether or not Capable can be implemented in a state like Wyoming, where we have these great distances and where really the culture, I think the culture of independence and wanting to do things on your own makes a strong argument for home modification. So really, we just want to do a good study that assesses whether Capable can be applied in a place like Wyoming. Yeah.
We have come to the end of this portion where there's a presentation. So we'd just like to mention that there is an open invitation for anyone here to join our Tier 2 meetings monthly, where we go in depth into what we're working on, which obviously this month is our stakeholder meeting. Next month we'll be probably reviewing what we did with our ACL grants and how that went, and probably a debrief session. But with new additions and people who, again, if you have medical contacts out there or construction contacts, handy workers and so on, we do need more people in those arenas, definitely, but we welcome everybody to the table. If you would like to help us with next steps and look at our documentation and our checklists and so on, that we going to try and build out that website and so on. So that's probably the next few months what we'll be working on. And they happen every Tuesday, once a month, between 9 and 10:30. So again, you have the emails here for any one of us, and we'll add you to that list if you're interested. So it looks like, yeah, we did that in the hour, which is fantastic. And we did want to open this up for conversation to everybody else. And do you think we should end the recording here and then open just a general discussion after from now on?
I think that's a good idea.
Okay.
I think so as well.
I'd encourage more participation if we're not recording.
Yeah, that's so just to end this, thank you for attending the first quarterly 2022 WyHMAC meeting, and we're going to end the recording here.